Hi, Dr. George. Can you tell us how big an issue is erectile dysfunction amongst Malaysian men?
Right. Okay. I'm glad you asked that question because last year Malaysia had this, like our health report card that was published. I know in the midst of the MCO, not many people get an immediate attention for this particular report card.
Mm-hmm.
And there's one section of it on erectile dysfunction. Believe it or not, even Malaysia, with such conservative community, we even publish that.
Right.
The data show that we have 1/3 of the general population, 1/3 of all the men walking in the streets in Malaysia have got erectile dysfunction. But the alarming thing about this particular report is that something like 30% of these 1/3 are actually younger age group. It's like ranging from about 18 to 29. And that is worrying.
So is the age getting younger?
Absolutely. In my practice, I observe that. And then also a lot of people feel that when they go beyond 50, they think this is a natural aging process.
Right.
And I think also there are a bigger group of people in the older age group are coming forward as well.
Okay, so what I'm getting from what you're saying is that it shouldn't be an age thing that this happens naturally just because you're older.
Absolutely not, because I always like to quote Mick Jagger. Obviously,
Right.
at the age of 78, he's still
Yes.
fathering a child younger than his grandson.
Yeah.
It shouldn't be an age. You shouldn't accept that your sex life will dwindle to nothing just because you have gone beyond 50.
No,
Just because you're creaky.
Yeah. Okay. But in the report card, though, does it actually focus on where these people are who have ED? Because I always wonder whether it's whether it's an urban problem stemming from, because we live very highly stressed lives living in the cities and everything. Is that a misconception?
Well, I'm from Kelantan myself, and then we like to think that in a more rural kind of like environment, you have a healthier lifestyle. Unfortunately, in Malaysia, we don't really have that. In the old days, perhaps activities and healthier lifestyle, perhaps the rural groups will have less of these comorbidities.
Mm-hmm.
But the report card shows that it's equally distributed amongst the rural and urban settings.
Really?
So it doesn't discriminate, basically.
Absolutely not.
Okay.
Wow.
So we're just talking about misconceptions. There are a lot of misconceptions out there that we've heard, like men, and I'm going to list them here because it would be great to hear your feedback on this. Men should avoid wearing tight underwear.
Yeah.
Too much self-relief causes problems. Placing laptops on laps. Too much soya food. Chicken neck. I don't know where that one comes from, but apparently it's quite well known. Cycling too much. Like, how valid are these misconceptions?
Okay, we'd have to take them one by one, right?
Okay.
I'm not too sure where that's coming from, but the misconception was that apparently the chickens that actually being fed a lot of hormones, for example, female hormones to make the chicken much bigger, will have significant amount of female hormones that can affect testosterone.
Right.
Perhaps it comes from that.
Okay.
And then other things, cycling and tight underpants, all these are related to fertility rather than in erectile dysfunction.
Okay.
Because if your balls get warmer, then the sperm's productions will have significant adversity. So all these issues about cycling and also tight underpants, perhaps they are misconceptions of infertility with erectile dysfunction.
So that means if your nether regions get too warm, as you said earlier, it's bad for your
bad for your sperms. There are multiple studies to show that if you use sauna, if you wear tight underpants, if you have something called varicocele, which effectively is a varicose vein of your testicles, then that warming up of the testicle by 1 degree will significantly reduce the sperm production.
Wow.
That is so interesting. I think we're going to have to do another show on this about fertility another time.
All right.
But coming back to what you're saying regarding the chicken necks, for example, does an increase in estrogen, for example, have anything to do with erectile dysfunction?
Absolutely. So if you consider erectile dysfunction have 3 components. Obviously, there's a psychological component. Earlier on you highlighted stress is an issue. indeed that is a problem. The second issue is the physical issues. For example, if you have a lot of comorbidities, high blood pressure, dyslipidemia, you have problems with diabetes, and all these will destroy the blood supply to the penis, and that will impair the erectile rigidity. And lastly is the hormones. If somebody has got hormonal imbalance, for example, if your testosterone is lowering due to various reasons, and then that can range from a very inactive lifestyle, a condition called metabolic syndrome. We realize that if you put on weight and then your conversions of testosterone to estrogen or female hormone is significantly higher. That's why men get man boobs whenever they are fatter, and that fat itself converts to female hormone, and that will have impairment on your erectile function.
Okay. So you also mentioned like if your testosterone level goes down for various reasons, does too much self-relief cause that also?
I love you use the word self-relief. Right? Okay, right. So indirectly, obviously on air for family show, we have to be very careful. That is a misconception that a lot of people have. Like, using it too much, you will use up all your quota in the future. You won't have it anymore. Right? Now, in Chinese even believe that you use up all your energy and your kidneys will stop functioning. Well, there is no scientific basis of this. In fact, there are multiple studies in Australia and also in UK showing that the more you ejaculate, the better it is for your fertility and also for the erectile functions in the future. In fact, Harvard Medical School actually came up with a report saying that the frequent ejaculation in your younger days actually have protective effects against prostate cancer. So all these, and in fact, I know you're going to ask me how frequent is frequent. Probably another day to ask, right?
Yeah. That wasn't my question, but that was probably his, but carry on.
Okay. In fact, this study was actually quite comprehensive. It monitored a group of healthcare providers in New England and also, in Massachusetts, in those sort of areas, including doctors, physiotherapists, dentists, monitoring them in their 40s, their 30s, 40s, and 50s. They realized that men who ejaculate more than 21 times per month actually have 25% less chance of getting prostate cancer when they're older. So you're doing the calculation.
A month though. Yeah, exactly.
That's incredible.
More self-indulgence is protective, official.
Okay, so let me take it back to what you were saying earlier about stress being one of the three major reasons for erectile dysfunction, right? Is there a correlation of, that sort of number of, self-help, what do we call it? Self-relief, actually helping in terms of there's the stress department, which is causing this problem in the first place? Is it
Well, multiple ejaculation, apart from having this effect of relieving whatever component is in the prostate that may induce prostate cancer in the future, what we know is that if you have frequent sexual activity, you are more likely to be a healthier person. For example, your testosterone is supposed to be better, and also you're exercising more, you have better stamina. That goes without saying. However, we all know that for both men and women, if you have frequent sexual activities, your blood pressure is lower, your stress level is lower. It's because of that good hormones, the happy hormones in your brain.
The
oxytocin and endorphin, and all these make you have that well-being and feel-good factors, and that itself definitely contributes towards a better lifestyle and better well-being.
Okay. So earlier we talked about the misconceptions. So there are a lot. Like some might cause ED, some might not. But from a professional standpoint, what are the most common causes of erectile dysfunction?
Well, I think, overindulgence in the younger days are definitely high up in our list, because what we have is that if we have lack of sex education in youth, and then a lot of people have these guilt feelings towards their later years, if they encounter problems, let's say because of stress, they will pinpoint to some sort of things that they did in the past. And the most common incrimination is that frequent self-indulgence. And I really think that is a vicious cycle. If you constantly have that guilt feelings, of course, you're not going to perform between the sheets whenever it comes to you and your loved ones. So therefore, all these things really needs to be debunked. The myth needs to be debunked.
Needs to be destigmatized, I suppose, because you're actually adding more stress to yourself, which is also causing issues as well, right, Doc?
Absolutely. Because like you said, the stress itself can induce erectile dysfunction, and the erectile dysfunction can make things absolutely worse. And we need to destigmatize and break that vicious cycle.
Okay. So just to clarify, in there's sort of 3 key areas that you're talking about, sort of stress, comorbidities, meaning other physical problems or physiological problems we may have, illnesses, for example, in our body, and or change in hormones and stuff. What are the most common causes of erectile dysfunction in terms? Are there any sort of illnesses per se that sort of directly correlate any particular major events in terms of stress or scenarios that are actually causing this, or hormonal issues that men go through? Like, is there such a thing as andropause that actually directly links to erectile dysfunction?
Okay, so there are 2 components to that question: the common diseases that result in erectile dysfunction. In the past, we used to think that it's 99% in your mind. So if you can't perform at night, it's all because you are just worried too much about it. But the study showed otherwise. It's 75 to 90% it's physical, physiological, pathological causes. And that includes erectile dysfunction induced by diabetes. In Malaysia, 1/3 of the population may have early sign of diabetes that they don't know about it.
Right.
And that itself will cause vasculopathy, basically hardening of vessels, and neuropathy, damaging of the nerve. So those will be probably in Malaysia one of the commonest disease that results in erectile dysfunction. The second one is hypertension. Obviously, hypertension can induce hardening of vessels. That's a condition called atherosclerosis. And there are many, many studies to show that this is a precursor of heart disease. Erectile dysfunction men can present 2.5 years prior to them getting a cardiovascular event later on. So for example, if somebody goes and see a GP and then mention that they've got erectile dysfunction, and perhaps if they change their lifestyle and get their condition treated, they may avoid an event such as heart attack 3 to 5 years later.
Wow.
Other things is dyslipidemia, which is cholesterol. Obviously, in Malaysia, a lot of us take a lot of medication. It's polypharmacy. And a lot of medication can induce erectile dysfunction as well, such as antidepressants, certain type of high blood pressure medication can also cause erectile dysfunction. Alcoholism, if you actually hit the bottles whenever you're depressed, and then obviously excess amount of alcohol can actually change your hormone and cause liver cirrhosis. And that is also something that is responsible for erectile dysfunction. And the other study from our health report card shows that many Malaysians have depression. Obviously, during the pandemic, that depression is quite exponential. It's gone up exponentially with people worrying about their job, worrying about their security, worrying about the virus. And then that itself, depression is one of the major causes, medical causes of erectile dysfunction.
Right. So you men are really quite lucky in the sense that, you know, it is like sort of a barometer for your health.
Right. Okay.
I mean, sort of like it's a precursor. Like if you notice something's not working right, it's kind of like, oh, I better go and check my heart out. I better go and check if I've got pre-diabetes, I've got to go and check. So that's actually quite
So you're saying that
interesting.
That's an actual yardstick?
Yeah.
Well, doctor, have I got it wrong?
You're absolutely right. We have this saying in our medical line: when you have a broken heart on, you are having a broken heart in the future.
Wow.
That should be on a t-shirt somewhere.
Can we make t-shirts for that? I think we should,
I think we should.
As a campaign. I think that's amazing. Okay, so Doc, let me ask you, what's actually happening physically when a man begins to experience erectile dysfunction? Like what's happening in the body?
Okay. So they will go through several stages, just like bereavement. First of all, fear. They have these anxiety. They don't know what's changing. They have multiple attempts. Then they go through denial. They say, it's because I had late nights. It's because I was drinking too much coffee. And then it's because the wife was nagging too much. Then they have this denial, and then they blame someone else.
Mm-hmm.
Then afterwards, anger. Then they go through this cycle of angry to say that it's all because they probably had too much self-indulgence in the youth. And then they all blame that, in the earlier days, they don't treasure themselves so much. And always there's an anger. And then followed by acceptance. When they have acceptance in Malaysia and in Asian setting, that's quite interesting, because that acceptance can come in a form of going round to get all sorts of opinions from your neighbors and trying different things. For example, we are obviously famous for our tongkat Ali, and then everybody has an opinion about how certain lotion and potion and massage can actually induce that recovery.
Right.
However, the acceptance itself can range for quite a long time because of this fear of going to see a doctor. When they have this fear of going to see a doctor because they worry that they might be dependent on medication for life, or they might be destroying their kidneys, or medications might cause too much of side effects. And that period can range from 6 months to 18 months. And eventually, what is the most important things they need to do is not that magic pill. It's actually changing their lifestyle. If they change their lifestyle, the vast majority of them can recover their sexual function quite adequately. And then therefore, the key part is not going for the pill. The key part is actually whatever damages that you do to your body in earlier days, and that itself needs to be rectified.
Actually, I also want to know, because I don't think I have a problem, I assume. So now I'm wondering, is there a stage where one day I'm okay, and then the next day, it just doesn't work anymore? Is that how ED works, or is it like a progression?
Okay, well, first of all, you don't think you have problems, but that's your own perception.
Yeah.
You have to ask your partner whether you have a problem or not.
Okay, yeah.
Let's get her on the phone, his wife.
Okay.
Open communication obviously is the key. Sometimes your partner don't want to hurt your feelings and never tell you that. However, if you have good relationship that you can open communication to say, darling, I think you're getting a little bit, it doesn't feel like the old days, better get yourself checked out. And then I think that is a good approach. And then following that, I think in order to find out you truly have a problem or not, because now knowing that all these comorbidities can result in erectile dysfunction, why don't we just check ourselves out on a regular basis to prevent that from happening? So therefore, if you can service your car on a regular basis to make sure it doesn't break down, why can't you service your body all the time to make sure that you function continuously like Mick Jagger?
Okay, so this leads me to something that I'm sure a lot of the female partners would be interested in hearing is physiologically, how do we tell? How can we help notice that perhaps things aren't the way they used to be?
Okay.
What's happening in the body in terms of the form perhaps looks different? I mean, what's actually happening in the body?
Like you were saying, that we can't hide, right? Okay, because the blood barometer, you really can't hide. The rigidity itself, it's either hard or it's not hard. And then, in fact, there are many scales that we have in order to work out whether patients really truly have erectile dysfunctions.
You have scales for this?
Yeah, there are questionnaires that you feel, early on you mentioned that there's acute onset of this erectile dysfunction. If that happens usually 1 or 2 times and then you recover, it's okay, because the real erectile dysfunction doesn't really happen acutely like that. It happened on multiple occasions over a longer period of time, then there's an issue. If you go to the web, there are many questionnaires that you can fill in yourself. For example, there's one is called IIEF. Basically, it's self-administered questionnaires, and it will come up with a score to find out the likelihood of you getting erectile dysfunction. However, for female partners, in fact, they can tell you that it's not as hard. For the male partners, sometimes you need a scale. A scale is called erectile hardness scale. It ranges from 1 to 4. in Taiwan, they actually correlate that with food. 4 is the mighty cucumber, and then the
Right.
3 is a unpeeled banana, and 2 is a peeled banana, and number 1 is a poor little tofu. So this is what
That's
they
in
do.
Taiwan. Do it. Okay, so sort of they grade the suboptimal erection that way. That's hilarious. I think Malaysians might actually find that helpful, to be honest with you, because we're so.
Though, really?
Well,
Wow.
okay, so let's talk about these sort of different degrees or levels, right? Should you do something about it? Should you go and see the doctor when you sort of get suboptimal 1? Oh no, suboptimal 3, because it's backwards. 4's
That's right.
good,
Okay.
right?
We always encourage you to see doctors whenever, because before it becomes too serious to 1 and 2. The reasons are, number 1 is that whenever you get it treated earlier, then you most likely do not need long-term medications, because if you can reverse all the damages at earlier stages, the chances of recovery is faster and better. The second reason is that the people who are at earlier stages or less severe degree of erectile dysfunction, the response to medication in much lower doses are significantly better. So therefore, for those 2 reasons, get it treated earlier is better. If you wait until you have a poor tofu, and then it requires a lot of resuscitations to get the tofu back to the mighty cucumber.
Okay, right. So ideally you want it to be cucumber, but when should a man start to worry? When you're at a unpeeled banana or a peeled banana?
Well, anything that is not a cucumber, go and see a doctor and get it fixed.
Oh, okay. All right.
And that stigmatizes the whole thing as well, because whenever you add a little bit of humor and our daily kind of things, because sexual health is just like any other health. Sexual health is like your mental health. It's like your gastrointestinal health. It's like your cardiac health. It's just one of your faculties that needs attention as well. So when you actually destigmatize it that way, in Taiwan, there are multiple studies to show that it actually helps people to discuss and talk about it.
Right.
Yeah, you'd go to a doctor if you had a sort of a sore throat, right? Or your throat was kind of gammy, rather than waiting until you had full-blown tonsillitis to have them removed,
the
right?
earlier the better.
Sense.
Okay, right.
But does that mean that regardless of the levels, generally speaking, it is something that's reversible, that you can be in remission, if that's the right word, from ED?
The vast majority of people, when they reach EHS1, they are people who had very severe diabetes, cardiac disease, probably had heart attack before. And those are the patients, it's most likely irreversible as far as the vasculature is concerned.
Right.
So under those circumstances, what we want to do is revive their sexual performance in some form of medications. And that can come in a form of the blue pills, which incidentally in March 2021, it came up in March 1998, believe it or not. Most likely both of you were not born at that time.
Gosh. Are you kidding me?
Okay.
I'll take the compliment. I'll take it. Thanks, Doc.
Okay, right. And then before 1998, there were multiple modalities of treatment. That includes injection directly into the penis, vacuum pumps, a prosthesis, and all these pre-blue pill devices are more likely to be effective for people who have got severe degree of erectile dysfunction.
Okay. Right.
So what I'm trying to say is that if you wait until it becomes so severe that it's in a state of a tofu, then your treatment regime will be a lot more complicated and more invasive.
Right.
And I just want to ask you a question there, going back to something you said earlier. If you're waiting to sort of get to the tofu stage, you're closer to having a serious heart condition, because you said it was sort of 2.5, 3 years away from that when you first start having issues. So when you get to tofu stage, you're actually, heading towards a bypass, possibly.
Absolutely, or even worse still, fatality from events such as heart attack.
Right.
Yeah, so, and really at that point, ED is the last thing that you should be worried about.
Yeah, stigma is like, do you want to live, basically? Right, So this is great. Okay, Doc, I wonder if you could walk us through a case study of yours, just to give us an idea of how this actually works. Sort of, they come to you, the treatment and recovery?
Was there one particular one that was slightly more difficult?
Yeah, well, actually, we have obviously this is an embarrassing situation for patients. So we have two types of patients who come forward. The type who will beat around the bush, then they'll come to clinic, they will say to you that their friend have this problem, their neighbor has this problem, just by the way they want to ask about it. And then, or sometimes they talk about they're having problems with urinations, their prostate is getting big. And then, oh, by the way, doctor, occasionally I have issues, or my friend have issues with erectile dysfunction. So that is the way that some men come forward alone, trying to legitimize their concerns about erectile dysfunction. And I think as clinician, you need to read between the lines and always give the patient that opportunity to say, one day when you're ready to talk about this, I'm here for you. So the way I function is that I always ask them about their regular issues. So for example, how's your weight? How's your bowel habit? How is your sleep pattern? And how's your sex life? So sometimes they get really shocked because, they say, oh, doctor, I'm not going to talk to you about that. And however, if you mention it enough time, one day they'll come back and say, by the way, 3 consultations ago, you asked me about my sex life. I wanted to tell you that I've been suffering from this condition for 2 years. And then you can tell that put a lot of strain in their relationship, hopefully not to the extent that their partner has run away. And then because their partner will feel very unloved whenever they avoid sex, they avoid going to bed together, they start moving to the second bedroom just because they can't perform.
Right.
The second type of patient that I encounter are the ones who are encouraged or dragged by the ear by their partners to the clinic to say, look, if you don't get yourself sorted out, I'm going to leave. It's not because they are leaving because of out of the non-rewarding sexual experience. They're leaving out of love because they think that their partner is having some health issues and their partners don't want to face it. Right. Majority of the female partners will encourage their partners to come forward. And when they come forward, the female partner with a third person, myself around, will start telling the truth and say, well, actually, it's been going on for 3 years already. I noticed that erection has been very soft for 3-4 years. And the only last time we had sexual encounter was about 18 months ago. And all the truth will come out, and it definitely will not come out if the man comes alone. And that's a time when they feel like, okay, they have nothing else to hide. They might as well just get themselves checked out and might as well just accept the treatment. So those are the two generalized, stereotypical kind of like presentations that I have of my patients with erectile dysfunction.
Has there ever been one case where the wife dragged the husband there and he tried to get it done, but nothing happened, and then they eventually, the wife walked away?
Yes, many divorce cases in court. The citations for the reasons for divorce is actually sexual dysfunction, and sometimes we even drag into that whole kerfuffle in order to prove whether the man is functional or non-functional, and that really makes things quite ugly. And then essentially it's something that can be resolved just with healthier lifestyle and also some medications.
Gosh, okay, so let's go back to what you were saying about treatment options, medications. What kind of medications? You talk about lifestyle changes earlier.
Yeah, obviously we are now dealing with the second Pfizer riser, but we had the original Pfizer riser.
Oh, Doc, if I ever had a problem like that, you're the person I'd send my male friends to. You're amazing. Sorry, carry on. Pfizer riser.
The first original Pfizer riser actually was the blue pill. The blue pill is a group of drugs called PDE5 inhibitors, phosphodiesterase inhibitors. And it was discovered by accident because this was designed to be a vasodilator, just designed to expand the size of the blood vessels in the heart so that it can help with high blood pressure. But accidentally in Wales, when it was trialed, they realized that the people who took the real drug versus the placebo, all the wives wanted to keep the medications, even though it didn't help with the blood pressure.
Okay.
then hence the drug was discovered.
Wow.
23 years down the line, it actually has 4 other versions in Malaysia. We have sildenafil, which is the blue pill. We have tadalafil, we have vardenafil, and we have udanafil. As you can tell from the name, they're from the same class of the medications with different pharmacokinetics. It's designed to help people with different lifestyle and different needs. For example, some of them are long-acting. The French call it le weekend because you take it and then it will last 36 hours.
Really?
So that spontaneity is there.
Right.
Some of them actually, when you take it, it acts very fast. Some of them are more suitable for people who has got prostate cancer and diabetes, for example. And all these are designed specifically for different pharmacokinetics. So there are a range of medication that helps with men. One thing that men are very fearful of is, number one, this has become addictive. So if you take it, then you're addicted to it. Come on, this is not morphine. This is not like opiates. It's not addictive.
Yeah.
The second thing that men worry about is dependency. Is that when you take this drug, then you will need this drug forever. Most men, if they take the medication initially, when they build their self-confidence, they change their lifestyle, they don't need this medication many months down the line. So it's all about perception and understanding what this medication is.
Actually, another thing that I'm pretty sure some men are worried about also is that if those don't work, surgery and to get to be opened up down there, it's actually quite scary.
It is very scary. So that usually acts as a deterrent for them to go down that route. So a lot of men will use that as a way in order to catalyze their healthier lifestyle. So then they will say, okay, not going down that route. And then if I can just wake up a bit earlier, go for that jog, sleep better, avoid the alcohol, watch my blood pressure. And a lot of men can be quite successful without getting that needles or the prostheses in the penis.
How often does that have to happen though? Have you had to do that a lot?
Well, we do that a lot initially. That momentum is great to help them, but that needs regular encouragement because they will go through 3 months of really, really good, healthier lifestyle. And then later on, that momentum, that enthusiasm will dwindle off, and then they will start indulging in nasi lemak and durian and that sort of thing. Their sugar goes sky high, and then they say, oh, die lah.
Right.
And then they go through the same thing. So we need multiple cycle of encouragement until they get their life back to routine.
How many of them need to get cut though?
Have surgery, I think is a
Yeah,
nicer way of putting it.
how-
Have surgery.
Exactly, yes.
Surgical intervention is not so common these days, and that can be easily measured by the number of the prostheses we sell, right? Because the prosthesis essentially is a fake penis that we put inside the patient. And then, so those in the old days, before 1998, we were doing perhaps something like, 2 to 3 per month. These days, we're doing 2 to 3 per year.
Oh, okay, all right.
Okay.
But still, that's very disturbing to hear.
So,
still, though.
I suppose also the the 3 months then falling off the wagon, it's just like having any other patient. You do make all these changes, and because they're not sustainably started, perhaps they're difficult to continue. But it's like a diet and everything. It's just kind of relearning a way you've been living for 45, 50 years. We've got to do it again, right?
Absolutely, because effectively all those comorbidities are just, eat healthily, cut down on carbohydrate, exercise more, sleep is very important because when you sleep at night, your body repair and also you build that desired testosterone. So we underestimate the value of sleep, and then that's itself rests your body. And when you actually sleep, you also have less stress. And all these are the process that is making you healthy. Not just below the waist, it's the whole totality that makes you a healthier person.
So I've got one more question.
Yeah.
Going back to something you said quite a bit earlier that I just remembered. You said people, your patients are getting younger. Is there any one particular reason for that?
Yeah. Well, if you look at the whole report card, the number of patients getting diabetes is younger. The number of patients getting cancer is younger. The number of patients getting blood pressure and dyslipidemia, they're all getting younger. And I really believe that is the reason why. And then I think we have obesity epidemic in Malaysia. We are the fattest nations. We're the nations with the most diabetes, and that itself started quite earlier in 2021. Therefore, I think that's contributing towards it. And then also, obviously, the stress and the anxiety of that earlier journey of career and sexual encounters also contribute towards it.
It's like the perfect storm just waiting to happen.
Absolutely. And we're all here playing our role to make sure that that storm doesn't hit our younger generation so hard.
Absolutely. I mean, I've got a 13-year-old son. I want to make sure that, he pays attention to his barometer of health.
Actually, when you drive around KL, and I'm pretty sure that's all over Malaysia as well, whenever you drive up to an intersection, or it's like probably a traffic light, right? You always get these little signages that's put up on the traffic light. It's basically virility energy drinks. Let's just call it that, right? Do those really work? Because you touched on it a bit earlier. Those that help men perform better, apparently that's what they advertise in those posters. Do they really work to reverse ED?
Okay. Many companies have actually come up with study to identify what exactly are the components or active ingredient in these lotions and potions. And in fact, a lot of study alarmingly show that a lot of these lotions and potions actually contain sildenafil. So the blue pill is infiltrated into that. Of course, it will work. Unfortunately, there are two problems. Number one is that it has this sort of like market in Asia is because, number one, people get away with selling these things without going to jail. And number two is that men are so embarrassed about going to see doctors, then they will just go for the neighbor's recommendation and then they'll pop the pill just to help themselves. So these is a two perfect match in order to make these sort of things quite prevalent in Malaysia.
And I was just going to ask you, these drinks as well are probably loaded with sugar, which doesn't help the diabetes problem, which doesn't actually help the problem that's causing it in the first place, right?
Indeed. But more seriously, if you're not suitable to take these medications, you will die from it. If these medications are contaminated with other medication when they're manufactured with no standards, you'll die from this. And then also, when you don't get that opportunity to get this yourself checked out for the real reason of your erectile dysfunction, you'll die from this. So is your life so valueless that you need to pop a pill from an advert in the junctions of your traffic light so that you can just, not treasure your life at all? So your neighbors will give you a pill that you pop in your mouth and with no accountability whatsoever following this consumption.
Yeah. And yet you won't take a Panadol because you don't like taking medicine, right?
Absolutely. That's right. Indeed. So it just doesn't make sense. And it all boils down to culture, our culture of incriminating stigmatizations and fear of your body change, especially when it comes to sexual health.
Wow. So how early then should we men start to be concerned and start checking up for that,
Okay, in fact, it's not early of checking up on that. You have to start early in keeping a healthy lifestyle. Obviously, prevention is the key here. If you start from very beginning and actually just live a very healthy lifestyle and then, exercise regularly, sleep regularly, hydrate yourself regularly, less anxiety, then you have a really smooth sailing of your overall health, including your sexual health. So the key is that first. When you start getting problems, then you realize that you need to seek help early. So those are the two key ingredients for younger men who are sailing in this earlier journey of life. It's just like you just need to know that if you abuse your body enough in earlier days, not in the sense of self-indulgence that we talked about,
in
the sense of the food that you take, the anxiety and that sort of thing, your body will abuse you back later on. And those things, the things that you're doing later on, is purely just to rectify or reverse all the abuses that you put in your body early on.
Cause and effect.
Correct.